Let's talk about autologous blood transfusion. Do you know what the autologous? All right. Anytime you see auto is like what? Something that is happening to itself. Okay? Or something is just happening. Yeah, something happening to itself. Okay? But if I'm talking about auto in related to machines, you see that something that is happening without control. But talking about auto in medicine, autoimmune, your body destroying its own cells using its own immune system. Do you understand? So auto is more of like something that is happening to itself. All right, when talking about it in medicine. So autologous blood transfusion. Summary, it just means what? They take up some blood in you, transfuse it back to you. Probably you are preparing for surgery. You come to the hospital earlier on, like past 3 months. They are taking blood. They keep it for you for your surgery in the next month. You understand? So if you are having a surgery that is scheduled several weeks in advance, you may be able to plan for an autologous blood transfusion, right? So now this is a transfusion in which you receive your own blood, which was drawn before your surgery, okay? So there are several benefits of receiving your own blood. There's no need for blood cross-matching. There will be no reactions and all this stuff, okay? That's just the benefit. Now, autologous blood transfusion, we say that this is collection and subsequent re-infusion of the patient's own blood back into their cells, okay? So, this is pre-operative for autologous blood donation. This one is basically like, okay, the blood was donated before the surgery, all right? Before the surgery, as you guys were preparing for the surgery and all the stuff. So that pre-operative autologous blood donation. Then we have the acute isovolumic hemodilution too, right? Then we also have another type, which is what? Intraoperative or postoperative blood salvage. This one I discussed in a different video. I've already uploaded it on my YouTube channel. This one now, as they are doing operation, blood is basically leaking out. But because once the blood is neat, not contaminated, and if the patient is not a cancer patient, okay, you can take out some of this blood that is leaking, okay, then put it into the salvage machine to purify it, remove the waste, and re-infuse it back into the patient. So I think, to my own understanding, the autologous blood transfusion is a very good thing, okay? It's just to prevent wastage, okay? Get your own blood, put it back into you, and it's basically conserving, okay? So that's it about the autologous blood transfusion. See you guys pretty soon.